EuroThreads are non-surgical sort of facial rejuvenation that's still procedural, and barbed sutures are these longer sutures that we place and basically in the same layer of deeper tissue that we elevate when we do a facelift. So they have barbs and then we elevate and pull them and they anchor deep as well. So we're kind of using the same vectors that we use in a facelift to elevate soft tissues under the skin. The outcomes aren't as long or as dramatic as a facelift is, so it's not really replacing a facelift, but it's a perfect tool for that patient who may not quite be ready for a facelift. The sutures that we put in are dissolvable, so they ultimately disappear, but they hold strength long enough for 18 months or something that really once they're gone, that we still retain what they did for us more or less. And I think another real positive from these is that it's totally reversible. If we put a suture in and someone doesn't like it, we can actually just take it right out, and there's no harm done to them. We may have given them a bruise where the needle went through. We really just set them still with numbing cream on their face for about a half an hour beforehand, lay them down, and then we use some local anesthetic where it goes in. And people feel some pressure, but you really don't have any pain. It's really not a big deal. And from a downtime perspective, people may get bruising like you would if you had filler or Botox or something because there's a needle stick, but not really very much. The second type of EuroThreads then are ones that we use a little bit like we do for filler. So they're being placed in the deeper layers of skin as opposed to the barbed ones, and it helps with fine wrinkles. So in the past, really all of our things that we really had as a good modality to help fine wrinkles had a lot of downtime, i.e. laser resurfacing type procedures that had some significant few-week downtime that people's faces really needed to heal. And in this case, there's really not any, but this really gets them an outcome that may be close to what they get from surgery at that point, and buys them some time for a few years until they're really are ready for a facelift.